Atukia te urunga, atukia te moinga, ko marama heke te pō, te koi ap, he whakarahia. Hira mai te hira, ara mai te ara, he manu whakarongo, tupua koa te manu nei, wā te tōre auta. Ko whete mai angutu, ko tū ki taha maui, ko rongo ki taha matau, tuturu whakamawa ki a tina. Tina. O mie uie, tai kie. A korore ki te atua i runga rawa he maunga rongo ki runga te mato te whenua he whakaro pai ki ngā tangata katoa, a tūhai, Māori tū, a tūhai, Māori ora. Te aura. Ki ngā mate kua haere atu haere. Haere ki Hawaii ki no Hawaii ki ro Hawaii ki Pāmamao. Ki te whare nei, te whare e tū, papatua nuku, rangi nui ki runga, tēnā kōrua. Ki te tangata, te hunga ora, ki te hunga mate, te hunga ora, ki te hunga ora, ai te hunga ora, tēnā koutou, ki ngā tangata whenua, ngā tangata, ngā iwi e waru, e noho ana ki konei, tēnā koutou, kei te mihi, ki a kōrua ngā rangatira kua tai mai ki tēnei, ki te tautoko tēnei kōrero, tēnei kōrero akonga, tēnā kōrua, nau mai hara mai. Ki a koutou, ngā hau e whai kua tai mai ki tēnei, ki tā rangona ki tēnei kōrero, nau mai hara mai. Nau mai miharo ki a koutou, e pai ki te kiti a koutou. Nō reira, kei te mihi, nau mai hara mai. My name's Alex Brown. I'm the kai kōrero for this meeting today. I started off with a tauparapara, which talks about the beginning of time, the creation of the universe, man, and then the creation of conflict. But we all come together as one. I then talked to the building and to Ranganui and Papa, and I talked to the building to stay standing, please. I then talked to the dead and told them to go away. They've had their time, but it's nice to remember them. And then I introduced our speakers, and you will hear to this wonderful talk that we're going to get today. So welcome everyone. Thanks.
Thanks, Alex, for your warm welcome. I'm Kirsten Capel, and I'm the Regional Associate Dean associated with the University of Otago, Christchurch, and I oversee the final year medical students at Nelson Hospital. So it's our pleasure today, and along with funding from the Care Foundation, that we're able to put on this session about feeling good and functioning well. And we've got two speakers today, Dr. Jenny Manuel and Dr. Ros Galetli. Our first speaker is Jenny Manuel, and Jenny comes from Christchurch, and she's a senior lecturer at the Department of Psychological Medicine. And she also, her presentation today will be drawing on her experience as a teacher, a researcher, and a therapist. So I'd like to welcome Jenny. Thank you. And I should just say welcome to all the people online.
Okay, is it working? Thank you. So, ko angarangi te whakapaparongo mai, ko waitangi te waka no te tahi te kāinga, ko mahia rātou, ko Frankie, ko Jamie aku tamariki, ko Ngāti Hikairo, ko Ngāti Parau rātou iwi, he kai pukinga matua hau, ko Jenny Manuel tuku ingoa. So, nice to meet you all here today. So I'm talking about wellbeing, unsurprisingly, and or being well enough is how I'd rather put it. So these are what I believe to be the key ingredients for mental well-being. But in my experience, when you tell people what they need to do for mental well-being, they don't tend to do it. And so I need to go into a little bit more detail and explain why these are such important factors in relation to our mental health and wellbeing. So that includes talking about what your individual or your specific needs are, the importance of taking care of whānau, because mental health starts in childhood, taking care of your relationships, including the one that you have with yourself, and also taking care of your physical health. So lots of content to cover. Early on in my career, I worked as a psychiatric nurse, and I really quickly became underwhelmed with the skills that I was being equipped with to help people in psychological distress. And that was largely because the way that we were treating people within specialist mental health services is based on a medical model of illness. So we're assessing them based on a set of diagnostic criteria. And if they meet the criteria for that diagnosis, we're medicating them, monitoring, and then discharging them. But it wasn't really giving an opportunity for people to actually learn about their mental health or to learn about what their well-being was in terms of being able to prevent future episodes of psychological distress or poor mental health. And so one of the skills, well, I went on and obviously did a lot more research, more training. And one of the skills I actually picked up really early on was something called clinical formulation. And I still think it's probably the most useful thing I've learned to date that equips me and helping people for their mental well-being. Now, it's got four sort of main components. We call them the 4 Ps. And so the first is learning about what might predispose a person to poor mental well-being, or what might be that person's individual vulnerabilities or that person's individual sensitivities for struggling to manage the stressors in their lives. And a lot of those factors are early life factors. The foundation for those early life vulnerabilities are laid down early on. The next aspect is, what are the precipitating factors? So what are the factors that might trigger or tip them over into an episode of poor mental well-being? And then perpetuating factors, which is what are the factors that are in their lives that maintain the status quo. And often the maintenance factors are things that relate to their early life or their predisposing factors that are ways of coping, but that perhaps are actually keeping them stuck in what's going on for them at the time. Then lastly, I've got the protective factors. So these are the people's strengths that we can draw on to try and recalibrate some of this sort of recipe, if you like, so we can get them back on track for good mental well-being. And you'll see down the side of the grid that there's a number of factors that come under each of those things. So they can be family related, they can be social related, they can be psychological, they can be physical, they can be spiritually related. And so I'm going to add to this grid as we go as some ideas and examples of things that we need to think about in relation to our mental well-being. So I mentioned one of the key ingredients is taking care of whānau, because mental health starts in childhood. Now there's two sort of really important things about our early lives that are really relevant to our mental well-being later in life. The first is attachment. So attachment is like the sense of security or safety we had in our early years, and that we get that sense of safety or security from our primary caregivers. And actually those relationships build the foundation for our later life relationships. We learn in those early life relationships a lot about emotions. We learn about how to express emotions. We learn how to regulate our emotions, and that's why it's so important that that parents are being well looked after, so they can provide that safe and nurturing environment, so that the children have a healthy development in terms of their emotional regulation. And the other major factor, I guess, related to early life is exposure to adversity or exposure to trauma. Now, we know that there's lots of research that shows that people who are exposed to trauma in their early life are going to have a lower threshold for stress later in life and have a higher likelihood of having quite high rates of psychological distress. And so, and the reason why those two things are so important is that we actually know that they actually shape the architecture of the brain. And I want to stress that that doesn't mean it's completely fixed, that our brains are very much what we call neuroplastic, which means that they can adapt and they can heal. But actually the earlier we intervene or prevent exposure to those sorts of adversities early in life is much better. And so the relevance of this is kind of twofold. I think the first point I want to make is that as a society or at the socio-political level, that we actually have a responsibility to take care of people and reduce their stressors, especially those that are parents. And in doing that, we're actually protecting the future well-being of our communities. And the second aspect related to that I want to mention is that it's useful for us to think about ourselves as individuals and reflect about us as individuals, about what might be some of our sensitivities related to our early life, what might be some of our vulnerabilities related to early life that will impact our mental well-being now. So these are some questions that might be useful to ask, and some of the questions are things that I would ask somebody in a therapy-based situation to get them to reflect on their past and how that actually impacts the current formulation for how things are going for them in their lives. So what were your values and beliefs? How was that shaped in your early life? Who did you go to when you needed soothing when you were a child? And so that's a question that I find that if people give say an answer where they say, I don't really think there was anybody, I don't really recall there being anybody, then that would start me thinking, what does that mean for you now? And often it might be that they're hyper independent, that they struggle to ask for help. It might mean that they have a tendency to internalize their emotions and keep their emotions in or not express their emotions. And the kind of things that if overdeveloped can actually impact their mental well-being. So it's kind of a useful question to think about. What did you learn about emotions in early life? Were emotions tolerated? Were emotions expressed? And if they weren't, how does that impact your relationships now? What ways did you learn to cope? And are those ways of learning to cope that you learned when you were a child still actually helpful for you in the present time? And how safe did social connections feel? So this is the grid, and it just gives you some examples of the kind of things that it's useful to know about what might be some of your vulnerabilities related to your mental well-being now. So what kind of things we know that could be perhaps sort of risk factors or factors that might indicate present time vulnerabilities. So things that were going on psychologically, the way that your sense of self was developing, whether there was a lot of stress within your family home, the social determinants, your experiences in schooling, bullying, those sorts of things. And then thinking about how has that impacted you and how does that impact your behaviour now. You can also see I've added in a little grid here that includes a perpetuating factor. And so what I really just want to illustrate is that often when we get a better understanding of what our vulnerabilities are from the past, we can see how some of those things play out in present time. So I mentioned internalizing emotions. So that can become a problem if that's your go-to way of coping, keeping your emotions to yourself, because that can disconnect you from people. And we know that actually being connected to people is really an essential ingredient for mental well-being. So sense of self. Who's heard of sense of self? Few people, yeah. So this is a fairly contemporary term, and it's sort of it's the concept of how do you construct who you are. It's about your self-identity in terms of who you think you are in relation to others, who you are in relation to the world. It's also about self-esteem, how you feel about yourself. And I think probably one thing that comes up most commonly in therapy with people, it's also about how you think others perceive you and how that then impacts your behaviour. So some useful kind of questions to get you reflecting about your relationship with yourself or your sense of self are things like, what are your values and do you live your life accordingly? Have you got a pattern of making choices based on what you think other people want from you? How much emphasis do you place on others' opinions of you? Do you take care of yourself before you take care of others? This is kind of the idea, is that sometimes if someone's developed a way of coping, say, for example, people pleasing, so they're trying to behave in a way that they think will make other people happy, over time, that can be incredibly exhausting for a person. It can be really tiring for a person to be constantly trying to behave in a way that's conducive to other people's opinions. And so that's why it's useful to reflect about these things, and so that when you're thinking about the action you take or the decisions you make, whether they align with your values rather than doing what you think other people want you to be doing. So we know that isolation, this is a New Zealand survey, a fairly small one, but similar things have happened with the international literature, that we can see that there's a clear relationship between loneliness and isolation and psychological distress, which isn't really unsurprising. And actually it's one of the bigger, stronger predictors of poor mental health, amongst other physical health conditions like poor cardiac health. And so that's why when you see wellbeing advice, they say they suggest connect with people, because we know that actually humans, that's what we need. There was once, at one point in time, some question, was it just that people who have really poor mental health are more isolated because of the nature of those illnesses? But actually, the research that's been conducted suggests that it's more the relationship's more the other way, that it's the loneliness and the isolation that's causing the poor mental health. Now, there's a huge body of literature also about how beneficial it is for us as humans in our own well-being to take care of others. So, and it's called pro-social behaviour, be kind to others, and actually in doing so that your mental well-being will improve. This is I've got a bit of a caveat with this one though, having worked with people in therapy, because people quite often like taking on this piece of advice, and I think it's a great piece of advice to take on. But if you're a sort of an extreme people pleaser that runs yourself ragged, looking after everybody, then this one's not for you. Okay. Okay. So you can see we're adding some things into the grid. We're adding things into the grid that relate to relationships. So, for example, relational triggers are often a trigger for poor mental well-being. I've also put there social avoidance. So when we start to get a recipe going on where we've got these sort of triggering factors and people's mental well-being is suffering, the way they cope can then become a perpetuating factor. So, for example, they might avoid social situations because it feels safe to avoid the social situations, but then that actually creates isolation and disconnection, which becomes a further perpetuating factor that sort of goes into the ingredient mix that keeps it being an issue in their lives. Now, the fourth ingredient was physical health. I don't have enough time to talk about all of these things in great detail, but I do want to talk about our circadian rhythms and the importance of sleep. And I also want to talk about the prolonged exposure to stress. We also know that healthy exercise and diet is incredibly important for our well-being, but I don't have quite enough time to go into that in detail today. So this is this is an idea about how we all have a 24-hour biological clock that runs in our body. Most people have kind of heard of this, and it runs largely on its own. It's a pretty well-tuned machine, and when it's running well, it releases different hormones at different times of the day that helps us sort of perform at our optimal level. Now, there are a couple of factors from our external environment that can actually impact the way that this internal biological clock is running. And the main one is, well, actually the main one is actually light and dark. And so there's a little receptor in our eye that picks up when it's light and dark. And that's when we travel across the world. That's how our biological clock can readjust. And it takes about 2 to 3 days to readjust with a new time zone. Now, what's this got to do with mental well-being? We actually know that people who have bad social rhythms, which is social rhythms or structures in the day that are really chaotic, and who don't have a good, strong sleep-wake cycle, that actually impacts how well the system is running. And it's been associated with adverse outcomes like mood disorders and anxiety disorders. And so if I was going to give you one key piece of advice today about wellbeing, your emergency first aid piece of key advice would be to tackle your sleep. If you're having issues with your sleep, that is like the most important thing to start with, because when you're not getting enough sleep, you're not getting enough rest, your body's not performing as it should be, and in actual fact, it's really difficult to do the other things or tackle the other things you might need to do for your wellbeing. And there's all the basic sleep hygiene advice out there, which is about habit change, and also just thinking about that light exposure. So before you're going to bed, not being on your phone, because that actually is telling this internal biological clock it's not time for sleep, so it's not releasing the hormones it needs to be releasing. Now, this this looks rather complicated, but this is about our stress response system. We've got two components, our stress response system. There's actually a little mistake in that slide. I should have taken that out. But anyway, what happens is in a spot in our brain, in our hypothalamus, when there's a stressor, it releases a hormone that tells our pituitary gland in our brain, which then releases another hormone down and to our adrenal glands, which is just above our kidneys, and that's what produces cortisol, and the cortisol helps us respond to whatever the stressor is. And then there's a negative feedback loop. Now, when someone is sort of chronically stressed or exposed to trauma, then there can be a bit of a dysfunction somewhere in the line of this occurring. And what that means is that chronic activation of that survival mechanism can lead to high levels of cortisol, and that can actually have quite a significant impact on many different parts of our body, and it has an impact on our physical health as well as our mental health. One of the areas in which it's been associated with mood disorders is that it can adversely affect the levels of neurotransmitters such as noradrenaline and serotonin. So the key take-home message to this in terms of wellbeing advice is, if you're on the hamster wheel and you are chronically stressed and you're constantly doing things and you're never getting a break, then you really need to think about how you might have to readjust what's going on in life, because chronic stress doesn't just impact us mentally, but it impacts us physically as well. So we've got some extra things now on our grid. You can imagine, now most people, if I was populating a grid with them or talking to them about what their clinical formulation is about what's going on in your life, they probably wouldn't have quite this many, but there's quite a few up there just for examples. What this now gives us an idea of is what to tackle. So rather than us looking at what the diagnosis is and medicating based on that diagnosis, we can now see what are the things that are happening in this person's life, in their environment, and their social lives that we can actually address, which ones we might want to address to actually try and recalibrate this. Now, the ones down on the left-hand side, the predisposing factors, they're not as modifiable. They can be, but they're not as modifiable. But the areas where we tend to focus on are preventing the precipitants and modifying or behaviour changing the ones that are the perpetuating factors, the things that are maintaining the issue. And so at that point, you kind of have to make a choice based on which ones are relevant for you about whether you're going to break or whether you're going to accelerate. So for some people, the obvious option is going to be that they actually need to break. They need to reduce the level of stresses they have in their life. And then for other people, it's a matter of they need to accelerate. So they need to start adding more things into their life to recalibrate. So some examples of things or strengths that we could add in that might help recalibrate. Things like regulating your social rhythms, decreasing your workload, seeking out help to reduce your social stresses, learning healthy boundaries, which means learning to say no. Talking therapies help sometimes with the psychological theories and figuring out all of this early life stuff. Acceptance or sitting through, and that really relates to the idea is actually sometimes some of us, one of our coping mechanisms that might be a perpetuating factor is that we're problem solvers. So we're trying to name what's going on and we're kind of looking for solutions, and there's not actually a solution. We can't problem solve ourselves all the time. We can't problem solve our well-being. And so in that context, that actually sitting through the discomfort of whatever's happening for you might be the appropriate option. Sleep hygiene, again, learning how to regulate your nervous system, and I think Roz is going to help a little bit with that and talk about that. And tending to your important relationships, and so the important lifelong relationships, not the ones with your boss, but the ones with the people that really mean something to you. Well, perhaps, and your boss a little bit as well, because that's important, but yeah. Now you can see that by doing that, I've taken out some of these precipitating and perpetuating factors, but I haven't actually taken out all of them, because the reality is if you're aiming for perfection, that's just unrealistic. That you actually just need to try and think, okay, which ones are actually doable for me right now? Which things can I address? And you can leave a few old firefighters in there. We call them firefighters. So like if you want to have, you know, like a bit of bad diet, or you want to have a glass of wine with your dinner, that's your firefighter. That's okay, as long as you're looking to try and recalibrate this sort of balance in other areas. And some of the things that the psychological factors have a tendency to stick around, but becoming more aware of them and reducing the impact of them can be can make quite a big impact. And so that's why I think that it's important to aim for being well enough, not be aimed for making my well-being perfect, or doing every single little piece of well-being advice. Pick the ones that are going to be the most useful for you, that are the most manageable, and aim for just being well enough. Okay. Thank you.
Thanks, Jenny. We are going to have a question and answer time at the end. So if you've got any questions, store them away. And for those of you online, we will have the Q&A in the chat there that we will look at as well. So our next speaker is Dr. Ros Galatli, and Ros is a very experienced GP who's been working in general practice for 40 plus years and is currently still working as a GP in Venom. And not only has Ros trained in general practice, but also hypnotherapy and neurocoding. And she's got a particular interest in wellbeing of patients, but also her colleagues as general practice. So I'd like to welcome Ros. Thank you.
Right. Yeah. Just talk amongst yourselves. I won't be long. Right.
I should just say the little bit of sleep, it brought back memories from my mother. She always said a good night's sleep's important, so I guess that dogma has just not changed.
Yeah, and that's where looking after parents, especially with young children, giving them a break sounds like a great idea. Okay. Sorry, can you just get rid of one of those? Fabulous. Sorry, it's not good when I'm mic'd up doing this. Right, okay. That's good.
Discovering the technology here.
Okay, that's good. Okay, look out, world, here I come. Great, thank you so much. These here. So, tēnā koutou, i te whānau, kua tai mai nei I tēnei rā. Welcome to everybody here today. So today we're going to be talking about feeling good and functioning well. But before we start with that, I would like you all to put your right hand up in the air, lay it down across your head, touch your left ear, give it a little bit of rub, come back up here, make a fist, put it on your cheek. I said, put it on your cheek, chin, 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 but I'm doing this. Right. So what I'm trying to point out is that actions speak louder than words. And today what I want from you is that you will take away some of the things that Jenny and I are talking about that you can actually use to make practical actions that help with your feeling good and functioning well. Te ma, te huru huru, karere, te manu. This is a whakatoki, a saying that is very special for me. This topic that we're talking about today is huge. So Jenny and I had to make a lot of decisions and choices about what we would actually share with you, given that we have relatively short amounts of time. And so in order for me to target that a little bit more, what I would like to know is who's in the room today, including all of the people out there in the virtual rooms. So how many of you already are undertaking regular exercise? Great. How many of you are already using mindfulness or meditation practices? My hand down again, I'm not being as good as I should be. Right, okay. How many of you connect with friends? The sort of things Jenny's talking about? Yay. How many of you get outside, spend a bit of time in some sort of natural environment? Excellent. Great. So these are all things which are proven to actually benefit our mental well-being and enable us to feel good and function well. As I was introduced, my work is now also using hypnotherapy and neural coding. So the next question I wanted to find out from you is how many of you have ever experienced trance?
Experienced what?
Trance.
Trance.
Hypnotic trance. Okay, well, I'd like to tell you that all of us have, yes, somebody up the back, hooray. But in fact, all of us have experienced that. It's a natural human state, and it gives us a phenomenal tool that we can use. Have you ever been so engrossed in something that you're doing, something that you love? You know, maybe it's a really exciting book or a film that's really captured you, or you're hurtling downhill on your mountain bike. You know, there's no time or opportunity to think about anything else. You just become absorbed in what you do. That is actually a trance state. You're narrowing your focus and ignoring everything else dims and goes out of focus, and you're unaware. The time passes, you know, who's talking to you, it's just not there. So that is a natural trance state. Have you ever driven somewhere and you get there and you think, how on earth did I get here safely? Okay, you were thinking about something else on the way. Your focus was somewhere else. Your automatic unconscious behavior allowed you to drive there safely. But these are all natural trance states. So hypnotherapy is very much about how do we actively use that human capacity to be able to connect with our unconscious and make changes. And the same thing is with neural coding. I don't know how many of you have ever thought about, how do you know that something you've just thought about was actually a memory from last week? How do you know it's not something now? You know it was in the past. How many of you ever thought about, why do you keep doing the same thing over and over again, getting the same outcome that you don't really want? Okay. Because a lot of that's around what's coded in our neurology. Many of the things that Jenny talked to you about earlier on are around that. What do we believe about ourselves, and how does that play out in our lives? Another thing is, have you ever thought about how you decide to buy something? So maybe it's a shirt or a blouse. So are you one of those people where your strategy is you just go and you see it, you buy it? You know, it's a visual thing and then boom. Or are you more like somebody who sees it, thinks, I like that, talks to themselves, goes and tries it on, that's a bit of feeling, kinesthetic stuff, then thinks about to themselves, what else would it go with in my wardrobe? Would it go with the new pants I've just bought? And then may or may not buy it, depending on whether they've had a conversation with themselves about, can I really afford this right now? So those are both two different examples of the strategies that we use, and they're in our neurology, and everybody's one's slightly different, and it can be really useful sometimes to discover or uncover what your strategies are. Because once you can do that, you can think, oh, maybe I could do this a bit of a different way. And the more knowledge we have about how our brain works, how we process information, really helps us with that. And one of the joys of neural coding is that you can actually discover an unwanted, out-of-date program that you're running, and just like a computer, delete that and reinstall something that serves you much better. So that's one of the joys of that, working in that system. These things, I think, all complement the sort of therapies. I mean, they don't replace many of those other therapies. They're a complement that can give you some really powerful and quick changes that will support you in the rest of what you're trying to achieve. So another example that I wanted to talk about with how our neurology works and what we know is around chronic pain. Now, it's taken us some time, but we now know that it's the brain interpretation of the signals that it's getting that tells you this is pain. Obviously, some pain is really helpful. It's something that's alerting you to the fact that you need to do something. There's something wrong, something's going on, whatever. But in some instances, the benefit of that pain has long since passed and people are stuck in a chronic pain situation. And it's interesting then to utilize the fact that it's the brain interpretation, because then we can ask that brain to switch it off if it's no longer necessary or helpful. And that's quite a powerful thing to be able to offer. So, utilizing what we know about how the brain works, I just wanted to give you 2 practical things you can do from today. And the first one is breathing. Yeah, we all do it, hopefully, but do we think about it? And there are many patterns of breathing that can help us, but as Jenny referred to, things that actually help us reduce that stress reaction, calm down our sympathetic nervous system, and increase the parasympathetic, are often tied to breathing patterns. So I'm going to talk to you about 3, and we're all going to have a try, okay? Good. So the first one I'm just going to talk about is called box breathing. It took me a while to figure out why it was called that. And in my simple world, it means that your breath in, the hold, the breath out, and the hold are all the same length. So like you're kind of creating a box or a square. So it's sort of... Okay, so we're going to do this 3 times, including you all out online. So taking a breath in, 2, 3, 4, hold, 2, 2, 3, 4, breathe out, 2, 3, 4, hold, 2, 3, 4. Another one, breath in, 3, 4, hold, 2, 3, 4, out, 2, 3, hold. Okay, 3rd time. Okay, so when we're doing these breathing things, I want you to notice what happens inside. Good. Okay, the second one is what I think of as qigong breathing. So it's where you have a breath in and you blow it out really hard and fast with a kind of sound. So, okay, right, really go for it. Okay, this is a good opportunity. This is a fantastic releasing breath, okay? It releases tension and it's very energizing. Already? So we're going to do our 3 qigong breaths. Ready? Good. Yes. Okay, like that. Another one. Yeah, final. Okay. So just have a think. How does that feel inside? Yeah, good. Right, okay. Now the third one is my favorite. It's called 7-11 breathing. It's got nothing to do with the local store down the road. It's actually just pointing out that your in-breath is shorter than your out-breath, and your out-breath really needs to be through your mouth, long and slow. So it's kind of, don't have to do too deep in-breath and out. Right. Okay, so once again, we're going to do this 3 times. So, ready? That again. One more. And as you breathe out, you can start to feel your pulse rate settle down, your blood pressure settle down, and your mind settle down. Great. Good, so that's the first little tool. The second one I want to do with you today is create an anchor. That's a slightly jargon term for actually associating 2 things or more together, linking them in your mind, in your neurology. So the advertising agencies do this all the time. You know, there's an image, there's a jingle, there's a product. Okay, that's just an anchor. We create these all the time for ourselves. There can be very useful shortcuts. Sometimes we create anchors that are not so nice, where we tend to associate some sort of situation with quite an unpleasant feeling. So I used to feel like that about going to the dentist from when I was a kid. But yeah, there'll be those sort of things. But you can also use anchors positively. So if you've ever watched elite sports people, and let's take the top tennis stars as an example, and they're there bouncing their ball the same way every time before each serve. And what they're doing is resetting themselves. That ball bounce, that action, the sound, all the feeling about that is them going, got rid of the past shot. I'm not taking any notice of the crowd around me and the court. I'm only focusing on how good I feel, and I'm ready for that next shot. So that's a positive anchor. Okay. So I'd like to create one for you guys. We're going to do that now. So I want you to think about a situation that may be coming up where up till now you've perhaps had a bit of a, not the experience that you want. So just take a moment, find a situation. You know, it might be there's a meeting that you have to go to that you always get frustrated in, or you know, you might have to get up and speak in front of people, right? Or you know, lots of different things. All right, or maybe you want to improve your golf swing, Bridget. All right, so, okay, so have you all got something, got a situation? Take a moment. You guys up there all on board? Good. You guys out in the virtual world? Excellent. Okay. Now I want you to come up in your mind with how you want to feel. So is it that you want to feel confident, relaxed, you know, in charge, able to move freely, whatever it is?
Confident and relaxed.
Sorry?
Confident and relaxed.
Okay, so that's what you want to do with yours? Perfect. All right, everybody else, have you thought about what you want? Yep. Good, okay. Great, so we're going to use a particular gesture today to create the anchor. In fact, you can use lots of things. Some people anchor to music or tastes and smells. Do you remember what the smell of your best friend's house was like? Or somebody's cooking something, a food that you love, like that's an anchor and you feel a little good inside. Okay. But for the purposes of today, I thought we would just use one gesture, and that is take your left hand, the thumb and the ring finger press together. Great. Okay, so that's going to be the anchor movement. Just let that go for the moment. I'll just explain what you're going to do. So you're going to go inside, allow that feeling that you want to come into your mind, then let it get really quite strong as you can. And when you've got it like that, press that thumb and ring finger together, hold it there till the feeling starts to fade, let it go. You don't want to have it dissipate. All right? So that's what you're going to do. So if you want to just start by maybe closing your eyes, let the feeling that you wanted to have, an instance of that feeling, come into your mind. Good. Allow it to get stronger. And when you've really got that strength, press your thumb and ring finger. Hold it while it's there strongly and let it go as soon as it fades. As soon as it starts to fade. Just take the time that you want to really get that feeling. Great. Okay. So, sorry, but I do want you to just come back now and open your eyes. Great, because now you get to do it again. But this time it would be really nice to ask your unconscious to provide you with another example of a time when you felt whatever it is that you want, confident and relaxed over here, but it could be anything else that you want, all right? So eyes closed, maybe a little nice 7-Eleven breathe. Great. Get that feeling inside. Let's get that unconscious mind to bring you another example of feeling the way you wanted. When it's really getting reasonably strong, press that left thumb and ring finger together. Hold the pressure there while you maintain that feeling. And when the feeling is beginning to fade, let go. Don't leave it while it's fading. Yeah, really, really let that feeling be quite strong. You're feeling it in your body. Great. All right. So everybody, open your eyes, put your hands up in the air, waggle your hands around. Great. Okay. Now, what I'd like you to do is just press that thumb and ring finger together, wait a moment, close your eyes and just see what you notice. You got that feeling? Yes. Great. All right. So that's an anchor. You can use that in all sorts of situations. You can create more. You can have different things that you tie it to. I actually taught this to my general practice team at one of our morning huddles, because it's often quite useful for us to have things that will help us to quickly reset and refresh through the day. You know, when you've been crazily seeing people and you're getting behind and you look at the list and you think, oh, I've got so many more to do. Right, so all they do is that, and that means they don't have to think their way through, or it's so much quicker for them to reset, get refreshed, and then really enjoy the next patient encounter. So I taught that, and then the next morning, one of my GP colleagues came in and said, you know what? I used my anchor before I got home to have to deal with my 3 young kids. Yes, a win there. Great. So I hope that you can use both of those things. Oh, hang on, I've got to get my technology right here. So now you have 2 tools that you can take action with to function well and feel good. So give the bird feathers and it will fly. So if we unlock our resources, we can achieve our potential. Kia ora tātou.
Thank you, Ros, and it's really great to have some really practical tips to go away with, and I'm feeling much more relaxed now. So we've got our Jenny and Ros here to answer questions. So those of you online, enter your questions in the Q&A, and have I got any questions here?
I'm wondering whether we should speculate about these things and question where the integrity of.
Yes, we just,
Thank you for your lecture, Dr.
Ross.
Dr. Ross.
Yeah.
From Blina.
And Dr. Jenny, yeah.
Where do you think we're going with this now? At the current time, in the profession?
Okay. In the profession.
I think there's lots of really good work going on in terms of the research world around how we can prevent poor mental health, and that is focusing on what actually makes us well. But I think that there's still room for us to refocus a lot of our efforts away from illness models and to start looking at these sorts of resources about how we can actually help people in a more comprehensive way and understanding themselves and gaining control over their own well-being. Yeah. So there's still room, I think, for improvement.
Thank you.
did you want to have any comment to that as well, Ros?
No. Sorry. No, I think Jenny's really encapsulated it, but I also think it's part of the movement that people have around exploring ways that they can support their own mental health. And, you know, the thing is, if lots of us around the world do it, then we're going to increase the uptake and increase the benefit in the world. I think that comes into things like connecting with our issues around climate, for instance, and how are we going to look after that natural world that we need to.
Thank you. We have another question.
Ros, could you explain a little bit about how wellness practitioners function within general practice, and do they use skills like we've been talking about today, or are they an emergency approach?
We're lucky to have started to have health improvement practitioners, HIPs, terrible name, and health coaches now working in general practice, thanks to our PHOs and ministry, that we can have an immediate handover, usually with somebody that we're working with who thinks, okay, this person would really benefit from some of this support. Some of those people will indeed use some of these techniques or use other models of what helps people manage, particularly anxiety, but many other things. So general practice, it's a great place to be there now, because you actually have got some people right there who can really help pick these people up.
No, just is it going? Yeah, just to add really that I think now within our primary care services that there seems to be a lot more funding has been directed to that area of health, so that these sorts of interventions, which are often quite brief interventions, can be provided as a means of sort of preventing it developing into more severe mental illness, and which is where we see people come into specialist mental health services, which is a bit overloaded, I suppose. And so in lots of ways that the initiatives happening in primary care are incredibly important.
Now I'm just going to go online here. Question, I think probably for you, Jenny. I've just recently learned that cortisol that is created from stress use up for us women estradiol and progesterone, which could cause an imbalance. Could you say a little bit more about that? Could be a slightly tricky question, but
yeah, that is a little bit of a tricky question. I think a group at work at the moment are doing some research around this, and unfortunately I'm not part of that group. But certainly there's an interaction between cortisol and those sorts of hormones, and it's particularly important for people in that sort of perimenopausal period. But I can't really comment too much more on that or give too much detail. Ros, you could...
I would agree. I don't have that, except to be conscious that in perimenopausal time, a lot of women find that they're more susceptible to anxiety and stress than they would normally be, and this is possibly part of that. I haven't seen it be quite so dramatic, but I don't really know.
Slightly different. So we'll take another one from online, but I've had a couple of people query about whether a copy of this presentation will be available, and it will be. That will be emailed to you afterwards. So another question up the back here.
I just wanted to ask about hypnotherapy. I've suffered from years and years of depression, and nothing really, I'm on quite a lot of medication, but nothing really, well, I can't get over it. So what happens to me is something else, it's situational. So something else happens in my life, and it's like climbing up a well, and I get to the top, and then somebody chucks a bucket of water on me and I slip back down, and nothing is really getting me over that, getting to the top. Like I can't get beyond that. So would hypnotherapy help in that situation where you just can't seem to get over it?
So just repeating the question for those online. So it's around, does hypnotherapy have a place in the treatment of depression?
It's certainly worth exploring. Absolutely.
Can it be done?
Yep, I'm sure there are a number of practitioners here. There's also the option to do things by Zoom these days. And in fact, you've got a global supply of hypnotherapists if you really want. Part of it is about getting you into a situation initially just where you have a sense of peacefulness and relaxation. And a lot of people who with anxiety and depression are often, that's a very rare thing for them to have. And then it's also about being able to rehearse a situation and where you might want to behave differently, but doing it in a way where you're safe at the time. So it'll be different for different people what they need to do, but it certainly is one of the many things that you can put into your armament of feeling better.
Do we have any more questions online? Any more questions here in the forum? One more. And given time's coming on, we'll make this our last question.
This is for me. We get quite a lot of students that come in and we've noticed in base level trauma and stuff. Is there, the wellbeing model is amazing. What would you be recommending rather than going to significant sort of support things within the general model, not going too advanced? What kind of advice are you giving for those kind of situations? Is that clear?
So just to clarify, students coming into where?
Teacher.
Okay.
Online teacher, but noticing a lot of students lot of complications of family situations. There's a lot of anxiety out there with the current state of the world and all that sort of stuff. And just how would you see this model relating to those?
Yeah, so when it's younger children that have experienced trauma, that we actually know that treating them directly is not the best approach, that actually you have to work with their families and their caregivers. And that actually has to be really comprehensive how you actually tackle that. So I mentioned that our capacity to provide a safe and nurturing environment for children is heavily socially determined. So one thing I would always consider would be how can you reduce the social stresses that the parents are experiencing? And if you can reduce some of the social stresses that the parents are experiencing, then they may be in a better position to learn more about what a safe and nurturing environment, how to provide a safe and nurturing environment and a safe, secure attachment with their children. We all have a different capacity based on our own history, the parenting we received, all those sorts of things. So it's actually really complicated. But I think that one of the issues in our current system is that we have a diagnostic model. And so traumatized kids don't necessarily meet those diagnostic models, but they will show that they have poor mental health in terms of their behaviour, and I'm sure you can relate to what I'm saying. It usually comes out in terms of behavioural issues, but actually the best approach, and it's a hard one, it's that our services aren't always well resourced to do, is to actually go in and really help the family as a whole, including the social determinants in which the stresses that they're experiencing.
Thank you, Jenny. Just one last quick question. And for those online, sorry, I wasn't quite quick enough, but that question, or that answer was in response to a question about helping our traumatised young people in the school system. One very last quick question. How many hours of sleep is recommended?
At least 7, but preferably 8. And also having a cold bedroom and there's all sorts of sleep hygiene tips, but aiming for 8. Oh, that would be a bit of a worry for me. Yeah, yeah. And I think as well, having a really regular rhythm. And so that is going to bed at the same time each night, however it suits your lifestyle. And you should be naturally waking up the same time each morning if your social rhythms and your biological clock is running well. And so that's one of the first things we will do if we have a patient that's really depressed or anxious. That would be our first approach, because that's how important sleep is.
Thank you, Jenny. And I think when we send out the copy of the presentation from today, this time last year we were talking about sleep and sleep hygiene. So we'll see if that's in the archives and we can include that as well to support today. So I would like to thank both our speakers. I've learned a lot, and I hope you've all learned a lot. And I will hand over to Alex to close our hui, but in the meantime.
Tuatahi ka mihi atu ki te Care Foundation kua tautoko tēnei kōrero nei. So first of all, I'd like to mihi the Care Foundation, who kindly supports this very important community initiative, and they're a great support of the community and for us as in the health system. So I'd like to tautoko them. Tuarua kei te mihi atu ki a korua, e whai ana tō kōrero, ka mihi mai oha ki a kōrua. Kia koutou ngā haue whakua taimai, kei te mihi, tēnā koutou. Kua mutu o mātou mahi mō tēnei wā, manaki tia a mātou, o mātou hoa, o mātou whānau, ai au ki te aorangi, tēnā koutou. Kia ora.